Hey y'all, it's Charda from Melanin Milk SD. I'm a certified doula, lactation consultant, childbirth educator, and a mom. One of the most common fears around birth is the question of how much do contractions really hurt? And today I'd like to give you a free childbirth education lesson on contractions, what they are, what they feel like, and how to cope with them. These tips will hopefully help you to avoid some of those feelings and empower you to have a more pleasurable birthing experience through knowing what the body is doing and why, and at the end, you get a baby. For a more detailed lesson or to see it written down, visit my website and click on blog. You can also sign up for my mailing list to receive notifications on new posts directly to your email so you don't have to go looking around for it. So, when will you go into labor? We don't know, but what we do know is it's triggered by unexplained hormonal changes, and most people give birth between 38 to 41 weeks, but the more you know, the more prepared you will be when it does start. And so when your labor begins, your cervix will start to open and dilate, and the muscles of your uterus will start to contract at regular intervals, and these are contractions. As your uterus contracts, you may start to feel discomfort in your back or your pelvis. It's usually described as really intense period cramps, and they become more gradual with a consistent pattern. They're steady and get more intense over time. Braxton Hicks, also known as false contractions or false labor, those can last for several weeks. Think of them as practice contractions. They are sporadic. They go away with movement or activity changes. Real labor and contractions will not go away. Your belly will get really hard during these contractions, and it will soften as the contraction releases. The peak of the contraction is the hardest part, and it's only about 10 to 20 seconds, and that percentage, it's only about 7 to 8% of the time of an average 8 hours of active labor. So that's about 20 seconds that you have to ride the wave as the contraction rises to the top, and when the wave is at its highest point, this is when we want to focus on our breath. You want to follow my Instagram and TikTok at Melanin Milk SD for breathing videos that are coming later on this week. So during pushing, as the contraction starts to rise, you'll want to take a big breath in, and on your out breath, you'll want to focus on bringing that breath down and through your body. And on your out breath, push the breath down and out the body in a controlled manner by keeping your face and your jaw relaxed and soft. I know it's really hard. I have been there, but when you feel tense and it's really hard to let that breath go, I want you to say to yourself, work with the body, not against the body. You want to remember, no force pushing. You want to breathe your baby out by allowing your breath to guide the movement naturally. And making noise is good. We don't want making noise like high-pitched noises like Mariah Carey. We want to do low-pitched noises like Beyonce's regular voice, not Beyonce's hollering voice. We want that low noise. So we want to relax the pelvis and help the cervix to open and soften. When you relax your face, everything relaxes. Your vagina, your perineum, that all relaxes, and it's how we reduce the risk of tearing and other interventions, which is like the number one concern on people's birth fears list is, tearing. So practice breathing, making low noises before birth, and keep in mind that your perineum moves, it stretches and it molds with you, and it can actually stretch to 10 times its size. 10 times. It's just like your bum hole, so that the baby's head can come out, and that just further confirms that we were designed to do this. Our bodies were designed to do this. So if your labor stalls or your contractions slow down, do not panic. Sometimes this happens as a result of too many check-ins from the hospital staff. Over-checking can cause anxiety for some parents, and so if this happens to you, your body will naturally respond by tensing up. And if we're tense, our pelvic floor becomes raised and the baby can't come down. So reassess the situation. If they start talking interventions to speed up your labor. And it's important to communicate that you don't want to add any more stress by rushing your body or your baby. Your birth partner can advocate for you and help make sure that your environment remains calm and safe. And the key is to feeling comfortable and supported before you actually start doing that breath work, before you're actually able to relax. So once you're able to focus on your breath, once those contractions start to build, it will help your baby find their way into the world. So when you think your labor has begun, you can also watch for signs of change, like losing your mucus plug, your water breaking, or your baby dropping lower in your pelvis, which is also known as lightening because the fetus isn't pressing on your diaphragm. So you might feel lighter. And this can happen anywhere from a few weeks to a few hours before the birth. And there, cozy and snuggled in, you're feeling a lot lighter up in the upper. So what are some ways to cope with contractions? Number one, holding a comb. Holding a comb can actually help block pain signals because the gripping sensation will help shift the focus of the pain on the body. It can also be used as a grounding exercise for partners in the room who might be feeling a little bit tense or stressed themselves. Pressure point therapy. Pressure point therapy. A good birth doula is usually pretty skilled at pressure point therapy. A birth partner can also learn this before birth as well, putting pressure on certain parts of the body, doing as much or as little as the birth giver would like. On lower parts of the back is really helpful where the pain is most common. You can also apply these pressure points to the hands and to the feet. And if you're feeling like you need some professional help in this area, try getting a massage or acupuncture prenatally or in early labor to help with the blood flow and to promote feelings of relaxation. Laughing gas or nitrous oxide. Some birthing locations will have laughing gas or nitrous oxide that is safe to use during birth and delivery. You can ask your midwife or doctor if they have this available to you, and if so, it can be a simple temporary tool to ease pain in a really quick and dull way. Just don't expect to not feel anything at all with it. It just takes the edge off a little. Affirmations are a fantastic way to have an empowered birth. Affirmations are a statement of your truth or something inspires you or affirms you and your experience. And if you're open to it, you can try visual affirmations. And I'm a super visual person with learning and teaching, so I like to use these with my clients. And it could be a photo or video. If it's a video, I like to use a looping video. You can also use one of the most powerful tools that you always have with you, which is your mind. And you can actually reframe your way of thinking to have a more positive birth experience. I have great visual affirmation practices on my blog at Melanin Milk SD, and you can check it out there on your own time. Try it out, let me know how you like. 5 is endorphins. Endorphins are a hormone that is like the body's natural morphine. It works wonders on me every time, whether I'm giving birth myself, whether I'm being a doula at someone else's birth, or if I'm just having a really bad day. A hug, a good laugh is a great way to boost your oxytocin levels and help release those endorphins throughout your body to make you feel good. And a good laugh really can be the best medicine. It's a natural pain reliever. A good hug, a good rub. And the more oxytocin you have, the more endorphins are released. The more endorphins means the less pain, because endorphins bind to the receptors of your nerve endings, and that prevents the transmission of the pain signals to your brain and your body. So remember, each birth is unique. Your first labor experience might be different from your third or your fourth or your fifth, but there can always be some level in controlling the things that you can to make things more comfortable for yourself, and use your prior experiences, if you have any, to help you with the next one, but don't compare it to that previous one. Don't be afraid of those contractions. Remember that they're waves. You can ride the waves. You can surf. You don't have to be afraid of contractions anymore. You've educated yourself. Practice your breathing. You'll be fine. And read my blog to learn more. That's all that I have for now. Take what you have learned, share it with a friend, a family, a client. If you like this video, please subscribe by hitting the bell. Follow me on Instagram, TikTok, and happy birthing.